Good day everyone. I am Annalyn Yago Tukop. So today we are going to tackle about the common musculoskeletal injuries. Health and fitness professionals need to understand different strategies in managing both pre-existing and acute injuries. Both type of injuries can affect a client's physical performance, and if not properly managed, it can lead to further injury. So dapat may different treatment of musculoskeletal injury. So when we say pre-existing injuries, if a client suffer from an existing injury, proper management is essential. Often clients will approach health and fitness professionals seeking advices for present and past injuries. Health and fitness professionals must respect aspects or scope of practice and refrain from diagnosing the injury. So we have the commonly reported symptoms of overtraining after injury, surgery, or both 18. First is the soreness that lasts longer than 4 hours. Soreness or pain that occurs earlier or is increased from the prior session. Increased stiffness or decrease of ROM over several sessions. Swelling, redness and warmth in healing tissue. Progressive weakness over several sessions. Decreased functional usage. The acute injury. If an acute injury does occur, early intervention often includes medical management. The acronym PRICE or the PRICE stands for protection, restricted activity, ice, compression, and elevation. It describes a safe, early, and intervention strategy for an acute injury. So sa acute injury naman, the acronym PRICE, amo na siya ang ga-describe sang safety para maka-recover sang acute injury. The next one is the flexibility and musculoskeletal injuries. Decreased flexibility has been associated with various musculoskeletal injuries such as muscle strains and overuse conditions. When a muscle becomes shortened and flexible, it cannot generate adequate or lengthen appropriately, which often leads to injury. Specific signs and symptoms and other precautions may require the health fitness professionals to stop or avoid stretching activity to prevent injuries. First one is pain. Restrictions by a medical doctor, prolonged immobilization of muscles and connective tissue, joint swelling or diffusion from trauma or disease. Individuals with osteoporosis or rheumatoid arthritis, individuals with a history or prolonged use. There are also specific contraindications of stretching. First is a fracture site that is healing, acute soft tissue injury, post-surgical conditions, joint hypermobility, area of inflammation or infection. So the next injury is common upper extremity injuries. Common upper extremity injuries include shoulder impingement, rotator cuff injuries, and the elbow tendinosis. First one is shoulder impingement. Occurs when the soft tissue structures, example given ang bursa, the rotator cuff tendons, get abnormally compressed. Then overuse can eventually lead to a rotator cuff tear if not managed properly. Signs and symptoms of a shoulder impingement is clients who suffer from shoulder impingement often complain of local pain at the front of the shoulder that radiates to the side of the arm. There may be swelling and tenderness in the front of the shoulder that causes pain and stiffness with movement. Early management. Conservative treatment often includes avoiding aggravating examples given of activity, the overhead and cross, placing a hand behind the back. Physical therapy modalities, example given ang ice or heat, oral anti-inflammatory medication, and cortisone injections. Exercise programming. Health and fitness professionals should educate clients on avoiding aggravating activities and improving posture and body positioning. So, I will be showing you a picture of a normal shoulder joint kag ang may ara ang shoulder nga may ara na shoulder impingement. The next one is a rotator cuff injuries. Rotator cuff injuries are common among athletes in overhead sports, example given ang volleyball, baseball, tennis, and in middle-aged individuals. Injuries to the rotator muscles may be from an acute episode or be chronic in nature. Signs and symptoms of rotator cuff injuries is the client will primarily complain of feeling a sudden tearing sensation followed by the immediate pain and loss of motion. The client will typically have trouble lifting the arm above the head. None. So, showing you the photo of a rotator cuff injury. The next one is the elbow tendonitis. Tendonitis of both the flexors and extensors of the elbow can occur with overuse of the upper extremity. This condition have been classified as either lateral epicondylitis or medial epicondylitis to signify the area of a tissue trauma. The lateral epicondylitis, often termed as tennis elbow, it is defined as an overuse or repetitive trauma injury of the wrist extensors at their origin on the lateral epicondyle of the humerus. That is the lateral epicondylitis. When we say naman medial epicondylitis, it is often called golfer's elbow. If ang lateral it is termed as tennis, ang medial naman it is golfer's. And it is also a repetitive overuse injury of the wrist flexors at the origin at a medial elbow. Common cause for both conditions include overuse, repetitive trauma, or muscle imbalance. This condition is common in adults 30 to 55 years old. Signs of lateral and medial epicondylitis is a client often complains of local nagging pain at the lateral epicondyle or medial epicondyle during aggravating activities. Early management of both is conservative treatment often includes avoiding aggravating activity, physical therapy, therapeutic modalities, example given the ice or the heat, assistive devices, example given the wrist or ang elbow splints, oral anti-inflammatory medication, and cortisone injections. Exercise programming should emphasize educating the client on avoiding aggravating activities and improving posture and body positioning. Regaining strength and flexibility of the wrist, elbow, flexors, and extensors is important. Showing you the golfers or the little leg elbow and ang tennis elbow. Now let's go on the lower extremity injuries. Common lower extremity injuries include the trochanteric bursitis, iliotibial band friction syndrome or the ITBFS, patellofemoral pain syndrome or the PFPS, infrapatellar tendinopathy, meniscal injuries, ACL injuries, ankle sprains, thin spleens, Achilles tendinopathy, and plantar fasciitis. Those are included in the common lower extremity injuries. So let's go with the trochanteric bursitis. The first one. It is characterized by painful inflammation of the trochanteric bursa between the greater trochanter of the femur and the gluteus medius or the iliotibial complex. Signs and symptoms of the trochanteric bursitis is the pain and paresthesias. Example given ang tingling, prickling, and numbness. Often radiate from the greater trochanter to the posterior lateral hip down to the iliotibial tract to the lateral knee. Symptoms are most often related to an increase in activity, repetitive overuse. Early management. Conservative treatment often includes avoiding aggravating physical activity, physical therapy, therapeutic modalities, and the assistive devices. Example given is a cane, oral anti-inflammatory medications, and cortisone injections. Exercise programming. When the client is ready to return to gym activity, a written clearance from his or her physician may be necessary. So let's go with the iliotibial band friction syndrome. The iliotibial band friction syndrome, or the ITBFS, is a repetitive overuse condition that occurs when the distal portion of the ITB rubs against the lateral femoral epicondyle. Signs and symptoms of iliotibial band friction is the gradual onset of tightness, burning, or pain at the lateral aspects of the knee during the activity. Early management. Conservative treatment of ITBFS often includes avoiding aggravating physical activity, the modalities, example given ice or heat, assistive devices, example given a cane, oral anti-inflammatory medications, and cortisone injections. Exercise programming. Client may present with weakness in the help of the ITB shortening and tenderness throughout the ITB complex. A slow return to activity is recommended with an emphasis on proper training techniques para iwas na sang injury. The next one is the patellofemoral pain syndrome. Patellofemoral pain syndrome, or the PFPS, is often called anterior knee pain or runner's knee. This syndrome has been found to have the highest prevalence among runners. In fact, PFPS makes up 16% to 25% of all running activities or running injuries. The cause of PFPS is often considered multifactorial and can be classified into three primary categories. The first one is the overuse. PFPS can occur when repetitive loading activities cause abnormal stress to the knee joint, which can lead to pain and dysfunction of the joint. The excessive loading exceeds the body's physiological balance, which leads to tissue trauma and injury. The second one is the biomechanical. Misalignment of the kinetic chain during activity can lead to biomechanical abnormalities that can alter patellar tracking or increase patellofemoral joint stress. Loss of the medial arc flattens the foot, which may cause to a compensatory internal rotation of the tibia or the femur that alters the tracking of the patellofemoral joint. The third one is a muscle dysfunction. Lower extremity muscle weakness, tightness, and length deficits have been associated with the PFPS because of its fascial connection with the patella, tightness, and shortness of the ITB complex. So the last one is the infrapatellar tendinopathy. Intrapatellar tendinopathy, or it is often called as the jumper's knee. It is an overuse syndrome characterized by a degenerative process of the patellar tendon at the insertion into the distal portion or the distal pole of the patella. Signs and symptoms. Commonly reported symptoms of patellofemoral pain syndrome include pain at the distal kneecap. The signs and symptoms commonly reported patellar syndrome include the pain and the distal kneecap into the infrapatellar tendon. Pain has also been reported with the running, walking, walking stairs, pwede man, squatting, or prolonged sitting. Example given ang theater sign. Early management includes avoiding aggravating activities. Ang mga may mga injuries, ang kalabanan nga ginahatag as an early management is avoid gid sang mga aggravating activities, which is for example, prolonged sitting, deep squats, and running. If may ara ka, infrapatellar tendinopathy. Now, showing you the anatomy of jumper's knee, the patellar tendon irritation. Ara da ang pictures, showing you the pictures and the exercise programming of the infrapatellar tendinopathy is that as with the PFPS, the focus should be restore properly flexibility and strength in the lower extremity, addressing tightness in the quadriceps through stretching and myofascial release. Example given on a foam roller. It can have a major impact on the dynamics of the intrapatellar tendon. And the continuation of the topic, you will be having Mr. Justin Ray Tumbukan to continue the report of some other musculoskeletal injuries. And that would be all. Thank you.